Shingles, also known as herpes zoster, is a painful rash. It is caused by a virus. The virus is called varicella-zoster virus. You may know this virus. It also causes chickenpox. Shingles usually appears on one side of the body. It often wraps around the torso. The rash forms blisters. These blisters can be very painful. Shingles is not contagious. This means you can't catch it from another person. However, if you have never had chickenpox, you can get it from someone with shingles. You would get chickenpox, not shingles. The varicella-zoster virus, or VZV, is highly contagious. This virus is responsible for causing chickenpox, a common childhood illness characterized by an itchy rash and red spots or blisters all over the body. It spreads through direct contact with the fluid from the blisters of an infected person. This means that touching the rash or even coming into contact with objects that have been contaminated by the virus can lead to infection. It can also spread through the air when an infected person coughs or sneezes. The virus particles can be inhaled by people nearby, making it easy for the disease to spread in crowded places. When someone with chickenpox coughs or sneezes, they release the virus into the air. These airborne particles can then be inhaled by others, leading to new infections. This can infect others who have never had chickenpox or who have not been vaccinated against the virus. Children are particularly susceptible, but adults can also contract the disease if they haven't been exposed before. VZV is a type of herpes virus, which is a family of viruses known for their ability to remain dormant in the body and reactivate later. But it is not the same virus that causes cold sores or genital herpes. Those are caused by different members of the herpes virus family, specifically herpes simplex virus type 1 and type 2. Those are caused by different herpes viruses, which have their own unique characteristics and modes of transmission. Once you have chickenpox, the virus stays in your body for life. It doesn't go away completely, but instead becomes inactive. It lies dormant in your nerve cells, specifically in the dorsal root ganglia, which are clusters of nerve cells located near the spinal cord. Most people never have problems with the virus again. However, in some cases, the virus can reactivate later in life, leading to a condition known as shingles, which causes a painful rash and other complications. Shingles is more common in older adults and people with weakened immune systems. Vaccines are available to help prevent both chickenpox and shingles, providing a crucial tool in managing the spread and impact of VZV. By understanding how the varicella-zoster virus spreads and taking preventive measures, we can protect ourselves and others from this highly contagious virus. After chickenpox, the varicella-zoster virus, or VZV, remains inactive in your body. This virus, which initially causes chickenpox, doesn't completely leave your system once the symptoms subside. Instead, it retreats and hides. It hides in your nerve cells, specifically in the dorsal root ganglia, which are clusters of nerve cells located near your spinal cord. This hiding spot allows the virus to evade your immune system. It can stay dormant for decades, lying in wait without causing any symptoms. This dormancy period can last for many years, often going unnoticed as you go about your daily life. We don't fully understand what causes it to reactivate. Researchers are still studying the exact mechanisms that trigger the virus to wake up from its dormant state. But we know that a weakened immune system can be a significant factor. As we age, our immune system naturally becomes less effective at fighting off infections and keeping dormant viruses in check. This is more common as we age. The elderly are particularly susceptible to reactivation of the virus, which can lead to shingles, a painful condition. When the virus reactivates, it travels along the nerve pathways to the skin. This journey along the nerves is what causes the characteristic pain associated with shingles. This causes inflammation and pain, often described as a burning or tingling sensation. The pain can be quite severe and debilitating for some individuals. The rash appears along the affected nerves, typically on one side of the body. This rash is a telltale sign of shingles and can be accompanied by blisters. Stress, illness, and certain medications can also trigger reactivation. These factors can compromise your immune system, making it easier for the virus to become active again. These factors can weaken your immune system, reducing its ability to keep the virus in its dormant state. It's important to manage stress and maintain a healthy lifestyle to support your immune system. This makes it easier for the virus to become active again, leading to the painful and often debilitating symptoms of shingles. Understanding these triggers can help in managing and preventing reactivation. The first sign of shingles is often pain. This pain is usually on one side of the body. It can be a burning, tingling, or stabbing sensation. A few days later, a rash appears on the skin. The rash consists of small, fluid-filled blisters. The blisters are usually red and very itchy. Other symptoms of shingles can include fever, headache, chills, fatigue, and an upset stomach. The rash typically lasts 2 to 4 weeks. The pain may linger for much longer. Section 5. Potential complications. Most people recover from shingles without any problems. However, complications can occur. One serious complication is postherpetic neuralgia, or PHN. PHN is long-lasting nerve pain. It occurs in the area where the shingles rash appeared. Other complications can include vision problems if shingles affects the eye, hearing problems if shingles affects the ear, bacterial skin infections, and encephalitis, which is inflammation of the brain. These complications are more common in older adults and people with weakened immune systems. Section 6. Preventing shingles vaccination. The best way to prevent shingles is to get vaccinated. There are 2 vaccines available, Shingrix and Zostavax. Shingrix is the preferred vaccine. It is more effective than Zostavax. Shingrix is given in 2 doses, 2 to 6 months apart. Zostavax is a live vaccine. It is given as a single dose. Zostavax is less effective than Shingrix. However, it is still better than not getting vaccinated at all. The Centers for Disease Control and Prevention, or CDC, recommends that adults 50 years and older get the Shingrix vaccine. Section 7. Managing symptoms medications. There are medications that can help manage the symptoms of shingles. Antiviral drugs can shorten the duration of the rash. They can also reduce the severity of the pain. Antiviral drugs work best when started within 72 hours of the rash appearing. Common antiviral drugs for shingles include acyclovir, valacyclovir, and famciclovir. Pain relievers can help relieve the pain associated with shingles. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, may be sufficient for mild pain. For more severe pain, your doctor may prescribe stronger pain medications. Section 8. Lifestyle and home remedies. Along with medical treatment, there are things you can do at home to relieve symptoms. Keep the rash clean and dry. Gently wash the affected area with soap and water. Pat it dry with a clean towel. Apply cool compresses to the rash. This can help soothe the pain and itching. Take over-the-counter antihistamines. These can help relieve itching. Get plenty of rest. This will help your body fight off the virus. Avoid scratching the rash. Scratching can lead to infection. Section 9. Seeking medical advice. When it comes to your health, seeking timely medical advice is crucial. This is especially true for conditions like shingles, which can have serious complications if not treated promptly. It's important to see a doctor if you think you may have shingles. Shingles, also known as herpes zoster, is a viral infection that causes a painful rash. It can appear anywhere on your body, but most often appears as a single stripe of blisters that wraps around either the left or the right side of your torso. Early diagnosis and treatment can help prevent complications. The sooner you start treatment, the better your chances of reducing the severity and duration of the symptoms. Antiviral medications can help speed up the healing process and reduce the risk of complications. See a doctor immediately if you have a rash on your face, near your eyes, or on your nose. Shingles in these areas can lead to serious complications, including vision loss if the virus affects your eyes. It's crucial to get medical attention right away to prevent long-term damage. If the rash is widespread or affects a large area of your body, it could indicate a more severe infection. In such cases, prompt medical intervention is necessary to manage the symptoms and prevent further spread. If you have a weakened immune system, you are at a higher risk for complications from shingles. This includes individuals undergoing chemotherapy, those with HIV, or anyone taking immunosuppressive medications. Your doctor can provide specialized care tailored to your specific health needs. Or if you experience severe pain, fever, or other concerning symptoms, it's essential to seek medical advice. Severe pain can be a sign of nerve involvement, which may require additional treatments to manage effectively. Your doctor can diagnose shingles based on your symptoms and a physical exam. They will look for the characteristic rash and ask about your medical history to make an accurate diagnosis. They may also take a sample of the rash to test for the virus. This can help confirm the diagnosis and rule out other conditions that might cause similar symptoms. Accurate diagnosis is the first step towards effective treatment and recovery. Section 10. Living with shingles. Shingles can be a painful and uncomfortable condition, but with proper treatment and self-care, most people make a full recovery. Vaccination is the best way to prevent shingles. If you do develop shingles, early treatment can help shorten the duration of the illness and reduce the risk of complications. If you have any concerns about shingles, talk to your doctor. They can provide you with the information and support you need to manage the condition. Remember, you are not alone.